Gut-directed hypnotherapy has been shown to significantly improve IBS symptoms in 80% of patients, and these improvements have been shown to last for 5 years. This is so impressive that the National Institute for Health and Care Excellence has stated that hypnotherapy should be considered for those who do not respond to pharmacological treatments. The main players in IBS are the brain and the gut, which are powerfully connected by the gastrointestinal tract. Now, in your gut there's an ecosystem, alive with thousands of organisms, the balance of which is as individual to you as your fingerprints. And this can make IBS difficult to treat with one-size-fits-all approaches. But when things go wrong in this ecosystem, your entire health is disrupted. Within your ecosystem is a bundle of around 500 million neurons. Researchers refer to this as a second brain. Your second brain doesn't do any thinking for you, but it picks up on disruption within your ecosystem and sends signals to your brain, which interprets them for their danger values. Your brain then initiates a series of emotional reactions. Something to consider is that all emotions are chemical, and these chemicals of emotion are produced in both brains, which increases the severity of your symptoms. It's already well established that stomach problems are one of the most common symptoms of stress and anxiety. And that's because when your brain identifies danger in your environment, it signals this information to the brain in your gut, which disturbs your gut's ecosystem. Then the whole system becomes sensitized. So even mild disruption that your brain-gut system would normally cope with easily fires up your IBS. Hypnotherapy targets your brain, changing the way that clusters of neurons communicate with each other. And this changes the way your brain interprets signals from your gut. All of this happens because of neuroplasticity. Remember, your brain has 100 billion neurons, and your gut has 500 million neurons. Hypnotherapy changes the way these two bundles of neurons communicate with each other and changes the communication pathway. Hypnotherapy for IBS is known as gut-directed hypnotherapy, and it's an evidence-based protocol developed at the University of Manchester, which is why it's come to be known as the Manchester approach. A typical treatment will involve relaxation of the mind and the body, focused control of abdominal pain and gut function, ego-strengthening suggestions that improve self-belief and confidence. CDs are provided for home use. Stress management runs throughout the program. Most importantly, individualized psychological and lifestyle factors are always accounted for.